Hey, this is Dr. J. This is the daily dose of vitamin H, and I'm really excited to have one of our patients, guests on here, Monica Sicard. She's just finished up a treatment protocol. We've got some really nice progress, and so I asked Monica, "Hey, would you help me spread some new good news out into the universe?" And so, Monica, you've been here with us about 6 weeks.
6 weeks.
Okay, so 6 weeks of care.
Yep.
When you first came in, what was happening?
What was happening was I had Lyme disease and I had hit the wall. I was having trouble getting out of chairs, large muscle weakness, a lot of trouble with my neck and shoulders, which had been previously injured, and just feeling like I was whooped, totally fatigued, couldn't breathe, and just looking for a last resort, actually.
Okay, so our office was the last stop.
Yeah, it was the last stop.
And some of the things that you had tried before, you'd done some traditional medical treatments, you'd done
Right.
some antibiotics, and you'd done some other things. And then one of the patients in the office had come here. She
Right.
told you to come check it out. You came here now. From the time of the treatment to now, how much better are you?
I would say I'm 60% better than when I walked in these doors 6 weeks ago.
And it was pretty, like, we were at the bottom. Like, we couldn't go any lower than when we first started.
Right. I remember you telling me I was on the downhill slide to death, and I was pretty critical, and not to worry about anything except rebuilding my immune system, which would take care of the other stuff in me, which was, the type 2 diabetes and the weight. And what's true is that that's happened. I mean,
Mm-hmm.
I've let go of weight, and without changing anything I'm doing, my type 2 diabetes is back down into the normal ranges. I can't wait to see my next hemoglobin A1C.
Awesome.
And
So, Monica, the treatments we did at the office, our team, we put together some IV treatments.
Yep.
You work with our nurse practitioner, you work with our medical doctor, you work with Dr. Nelson. What are some of the treatments that just really popped out that were different than what you'd received before?
Well, for one, the IRR, the infraspinatus respiratory reset, it was huge for me because when I showed up here, I felt like I was sipping air through a cocktail mixing straw, and now I feel like I can breathe really, really well. The other thing that has really helped was the procaine treatments. My neck and shoulders, working with Dr. Nelson and Shelby, and having chiropractic adjustments as well. And the immune bag and DMSO, that stuff just really worked. But the thing that I think is the glorious thing is the UVL, which cleans the blood, and the ozone,
Okay.
ozonated blood treatments.
Awesome. So what she's talking about, there's a way to reset nerves and help the lungs. They call it the infraspinatus respiratory reflex. And then what makes our office unique is it's a team environment where none of us care who gets the credit as long as the patient gets better. We use some medical intervention, a nurse practitioner, acupuncture, chiropractic, prolozone therapy, the procaine treatments, etc. And we're really excited. Monica, this is not the end. Like, you're going to continue to get better. Like, we
Right.
started this process, and we're going to keep going. Even though you're not in the office, we put together a plan to keep you there. And so I just wanted to get some good news out to the universe, say what we've done, what makes us a little bit unique. We're really excited for Monica to go home and continue to heal, and we're going to have a follow-up with her next year. And so, Monica, thank you so much for coming on our blog.
I want to say one more thing, Dr.
Okay.
J. When you walk into this clinic, there is a definite belief here that if you are willing to heal, you will. And that belief is in the way I say it is, there's a belief here beyond a shadow of a doubt that you can heal. And when you step into that, it has an energetic effect on you. So if you're out there and you're without hope, this is a place to come.
So eventually it's okay to put it on social media?
Absolutely.
All right. So you guys, this is Dr. J signing out. Thank you for watching our daily dose of vitamin H.